can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.
Hello, good morning everyone. I am Dr. Julie Hammond. I am a GP. I'm also a very passionate advocate for mental health, women's health and also health equity, and I am the CEO and founder of Mama, which is a digital health platform designed to help support parents from preconception to the first 1,000 days of their child's life. So it's always a pleasure to be working with Carn. I'm so passionate about the work that they do and all the difference that they make in our communities' lives. So I'm happy to be here as the host for today's session. So today's session is called a call to action about giving blood and also helping to save lives as well. And in addition to that, I want this session to be very interactive. So please leave a comment from where you are joining us from the globe, because I've been told by Carn that this is an international session. So we have people joining from all around the world. So please leave a little hello and where you're tuning in from today. And also, I want it to be engaging. So please leave any questions you may have as we're going through the chat. So first of all, good morning and welcome to everyone who's joining us today. And thank you for not giving up your Sunday morning, but taking your time on a Saturday morning to join us today. So the reason why this session is so important is because we've seen it in recent years that there's been a rise in demand for some rare blood types that are more common among people of Black heritage, including people from Black African, Black Caribbean and mixed ethnicity backgrounds. So this is the reason why we created this session today and why we've got so many people speaking to us today with lived experiences of sickle cell and also of giving blood and also have receiving blood transfusions as well. So first of all, I'm going to hand over to our first speaker, which is Dr. Anika Enegbu, who is a GP partner at Horncastle Medical Group in Lancashire. She's also a former consultant anaesthetist. She has a master's in public health, a diploma in dermatology, a PG cert in medical education, and she's a mum of 3. So she's got vast credentials in terms of her talk today. And she's going to be talking more about addressing the mistrust and misconceptions about blood donations in the Black community. So I'm going to hand you over to her now.
Hello, everyone. My name is Dr. Nneka Enegbu, just like Julie has said. And my background, the reason why people say, why are you interested in blood donation and organ transfer? That stems from my background in anesthetics, where hundreds of surgeries or thousands are done or millions are done all over the world and blood is needed. Also in people in intensive care unit or chronic condition need blood. So now, why again do we need blood when there are emergency surgeries, possibly following trauma, during childbirth? If there's complications and there's bleeding, blood is needed. People with chronic conditions frequently need blood transfusion. In fact, it says that 1 in 2 people among all of us will need blood at some point in time. For example, women, all women going through childbirth, there's a chance that possibly you may or may not need blood. So there are about 135,000 new donors needed in the UK every year. And when one person donates blood, it can save 3 lives. That is because the blood is divided into separated into different components and given to who needs it, what components of the blood they need. There are about 6,000 transfusions performed daily in the UK, And when you give blood, you only give just about half a pint, less than half a pint. So when I was going to do this presentation, I said, well, you're not just going to talk the talk, you should do the talk. So because of that, I registered and donated blood, experienced what it means to donate blood, and it was a pleasant one. And we'll talk about it possibly as we go on.
Fantastic. Just wanted to say if you can also share your screen with us, because I know you prepared some beautiful slides.
Oh, you can't see my screen? Oh,
Not yet.
Okay. Bear with me. Sorry about that. How do I do that again? Go to the green part.
Yes, if you go to share.
Can you see my screen now?
It's starting up. Yes, we can see your screen now. Thank you so
Is
much.
it? Okay. Thank you
you.
for letting me know. So I'll go back to. Right. So this pie chart shows the number of Black and ethnic minorities who are donating blood. And this red slice, which is just about 3 to 5%, shows the number of us donating blood, while the blue part is the non-ethnic Black and ethnic minorities donating blood. So this will give us the understanding of the disparity. There are about 1 million donors in the UK, and just 3.5% of us are donating, making, in spite of 14% of the population being Black. There is a high demand for us to donate because we have specific blood types for specific people, and people match closer to their own ethnicities. And that helps prevent further complications. Now, why are we focusing on our community? That's because the sickle cell trait is very high among the Black and ethnic minority. So if you look here, this highest number is for us, Black and ethnic minority. That means 1 in 10 of us have the sickle cell trait. I'm sure in our families, we know people who have AS or SS. Even if it's not SS, for having S, a lot of us have the trait. Also, other conditions like thalassemia among the Asians means that we need similar kind of blood groups. And regular transfusion is needed because a patient with sickle cell sometimes may need blood transfusion almost every week, or up to 20 pints of blood a year. So it's necessary that we come up and support our own. Now, what kind of blood groups do we have? We have the O positive and negative. We have the A positive and negative, B positive and B negative, A positive and AB, so AB positive and negative. And looking at the graph, you can see that we, the Black and Caribbeans, we have the highest number of O positive blood. That means a lot of us will be needing O positive blood. And if we're not donating, there may not be enough from other ethnic groups who are donating. Also, the Rho type blood is higher among us. When I donated, I got a letter that says, oh, you are Rho subtype, and only 3% of the population have this subtype. If most people who are donating are not us, and only 3% are giving this blood habits, then we need to donate more. But the good thing is that 55% of the Black donors have it. That means there's call to action for us to give more. What are the barriers to donating blood? There are multiple barriers. For example, language barriers, work schedule. Some of us, because we have to send money home, we have back home responsibilities, and we book a lot of shifts, we're always busy and we don't have time. Also, transport issues, Others are lack of awareness. So we know that there's blood everywhere, but do we actually know that people donate this blood? Some people may say, I don't know. If I had known, I would have donated. Some people may think, oh, I thought it was you needed to just buy blood. No, all bloods in the UK are donated. Therefore, it's important for us to donate. Mistrust in the healthcare system is another barrier. Some people feel like because in the past in the US, there was a Tuskegee research where Black people were opted into some research and were not treated for simple conditions and they died. So there's mistrust, also concerns about how is my blood going to be used, fears about discrimination at donation centers. If you notice that 97% of people who are donors are not Black, if you go there, you may be the only one and may feel isolated. So the more of us that go and present ourselves and donate, the more there is availability. Also, religion and misinterpretation and myths about blood, cultural taboos. Some people feel like if they donate their blood, it could be used for rituals, or how is it handling? Will they give it to other people and not give it to us? So 67% of Black and ethnic minorities have never been asked, just like we said before. Nobody asked me, and how come am I going to donate if they're not asking us? So now we're asking, and they said about 40% cited that even when asked, they are worried about they may not trust the system of how their blood is used. And some talked about 30% talked about cultural beliefs and religious beliefs as reasons. So these things are really strong built in us. But hopefully by talking about it in situations like this, it would help dismiss bust some myths. Another thing I'll also bring up is there's some people, even in the healthcare sector or who are informed, have presented themselves to donate, but they will say, ask you, have you had malaria? And if you say yes, they could turn us back. So probably, hopefully in future, they could work around that, because some people have been in this country 10 years and had malaria 10 years ago. It's not likely they still have it, but still they are turned back. So those could also be barriers even when we present. Talking about cultural and social beliefs in Islam and different cultures, religion, for example, in Islam, interpretation exists about regarding blood donation. Some Islamic scholars, I agree with it. They say it's a form of giving. It saves lives, which is true. Blood donation saves lives. If someone needs blood donation and there is no blood, anything could happen, unfortunately so. And some people have concerns about ritual purity in the Islamic religion, and especially during Ramadan. These concerns need to be discussed and so people can understand and give. The African traditional beliefs can be quite strong rooted. Some people believe in the spirituality of blood. They hold it into, adhere to their ancestry, to their identity, and they feel that it may be used for other purposes outside medical purposes, but that is not the case. Any blood that is being donated is wholly used for medical purposes. The Hindu and the Sikhs believe that blood is considered as life, called prana. So they feel like if you take blood from them, you have taken their lives and taking their power, their vital energy. But also the other thoughts in Hindu religion believes that it's a virtue to give, donating to save others. And also some people may believe and say, oh yes, now I've heard this, I'm going to donate blood. And pressures of the society, like you tell your friend and they'll start saying all these beliefs that they have to discourage you, but you have understanding now that mainly it's for the purpose of giving life. And also we don't know, it could be us that would need this blood. If we need blood and it's not available, how is it going to be? So it's important that we have a better understanding to act better. So talking about mistrust, we talked earlier about this Tuskegee syphilis study. So there's somewhere in the US, in Tuskegee, where some Black men who had syphilis were not treated. They told them they were being treated, but they were not. So I watched that movie on YouTube some time ago. It was really touching how they thought they were being treated, but they weren't. And a lot of them, almost 400, died. And also in between 1980s and 1990s in Bristol, it was said that children of ethnic minorities got less optimal care. Between 1940 and 1970, Black people were more diagnosed with schizophrenia and section. And also, even during the Windrush, people have come in, worked, and after some time, they've asked them to go back. But these things are changing. There are a lot of us working in the healthcare sector. Because we're represented, we know that the right thing will fight for the right things to be done. So that would encourage us to donate more. What are the strategies? How do we improve this? Community outreach, like we're doing now. Cultural sensitivity is there. We should respect it. But probably explaining better to them may make them understand. There's nothing written in stone. Maybe it was because of lack of understanding and with more knowledge, people could change. Partnering with people in the leadership, in the churches, in the mosque, in the communities, and discussing more about blood donation can also help. Innovative approaches. This day of Gen Z, online, social media, influencers could put hashtag blood donation, talk about their experiences. It says that 83% of young people got to know about blood donation through social media, through digital campaign, which increased the number of donors in those communities by up to 45%. Also, other ways are making multi-language resources available for people to understand. For example, maybe after this session, we put using innovation, hashtag donate blood, or talk about it more, because you can reach millions online. So the impact of increased donation. For example, if all of us who have listened to this, or most of us, decide that, okay, I'll take that step to donate. For example, when I wanted to donate, initially I didn't, even as a doctor, I was wondering, what was the right place? I checked online, blood donation, yes, and I saw the link, clicked on it. It was very easy. Within 5 minutes, just a few questions, your name, your address, and just a few questions, and he said, okay, you can donate. Use this link to book your appointment. It was the easiest way to donate blood. So if we know and use it, for example, if you look at this pink area down here, so look at in 2028, with the way we are now, the number of people donating may reduce. And if, for example, after this session, we all act, the number of people donated will likely increase. Look at that increase all the way up. And this green line here shows in 2028, the number of people that may be needing blood is up here. So if we all act, there's a chance that we'll be matching demand and supply. But if we don't act, the demand and supply, there'll be a lot of demand and there'll be less supply. Why do we need our people to donate? Because you get the best matched blood to your own blood type. That reduces autoantibodies and adverse reaction to blood donation, better treatment, people recover earlier, less stay in the hospitals, and better improvement to the whole community, to our family. We're well and able to do our daily activities. So with this call to action, we're saying, please register to donate, sign up and become a regular donor. Each person can donate up to 3 to 4 times a year. Bring a friend along, advocate, talk about it. Let your discussion this week just throw in a bit of blood donation, ask somebody about it, share people's views. You can even become someone who is educating others, encouraging others to donate, and also let's act on what we say and try to donate. So summary and the takeaways. So there's critical need for us, the Black and ethnic minority, to donate because our people need it. We need it. There are barriers. Hopefully we'll be able to go beyond these barriers with ourselves and also with government changes, allowing people who may have not had malaria for many years, bringing technologies to allow them to donate because a lot of people want to donate. So if there are strategies to help give them allowance to do that, and talking more with other people in the churches, mosques, and everywhere, that will improve awareness, engagement, and sustain participation. So these are resources. Go to blood.co.uk, click Give Blood, donate, and these are societies that also talk more about it. Let's use our social media to promote it. And yes, Black and ethnic minorities are happily donating blood. Let us join the cause, and I'll give you a quick experience of my blood donation experience. So, sorry. Thank you so much for listening.
Thank you so much for joining us today. And I found your video at the end particularly powerful when you showed your experience, because usually we don't know what to expect and we tend to panic and feel quite nervous about going ahead and doing a blood transfusion. But the fact you showed us the whole journey, I think that was particularly powerful. So thank you so much for doing that. And thank you for your time today. Thank you. So we're saving all the questions for the end. And so Dr. Enigri is going to be with us for the whole talk session today. So what I'm going to do now, I'm going to hand over to our next speaker, who is Kelvin Campbell. He works for NHS Blood Transfusion. He has lived experience of sickle cell disorder since birth. He's experiencing constant pain and has spent most of his life in and out of hospitals. He's had regular blood exchanges which have transformed his life, and it's allowed him to work for NHS Blood and Transplant. And he also travels with the B Positive Choir, and he advocates for blood donation from Black donors whose robe subtype is particularly crucial for sickle cell patients like him. So I'm going to hand over to him to give us his experience. Thank you so much for joining us today.
Thank you. Thanks for having me. Thank you for an amazing introduction, Julie. I'll just share my screen. Can you see my screen?
Yeah,
Yes.
yeah, we can see your screen. If you could just speak up a little bit more, please, because it's quite quiet on your side. Thank you.
Sorry about that. Okay, so my name is Calvin Campbell. I work for NHS Blood and Transplant. I also have sickle cell, diabetes, and epilepsy, and a host of other illnesses. And why I'm here today is to explain why blood donation is important, in particular within the Black and Brown community, and why more of us need to donate. In particular for people with sickle cell and thalassemia. Sickle cell and thalassemia are the world's two largest genetically inherited disorder. Sickle cell is this country's largest genetically inherited disorder and growing. So of the 1.4 million units of blood the NHS Blood and Transplant uses every year and donates to all the various parts of the NHS, we need roughly 475 new donors. That's of all colors, every single day.
Sorry, Campbell. Sorry to interrupt you. Please, could you just make it full screen so we can see the slides a bit better? Thank you.
Big fun. At the bottom.
If you go to the bottom right-hand side, of the page where yeah, if you go up a little bit where there's like a little screen, you know where the zoom is. Or if you go to the top where it says slideshow on the tabs on the left, and then yeah, it's the fifth or sixth one down. Top left hand side, underneath the title of your presentation. Yeah, it should say slideshow. Can you see where it says home on the top left hand side of your screen? Yeah, if you just go through the right hand side, you should see, if you keep going down that lane, you should see a slideshow.
Oh, I'm good. Wait a second. Sorry.
Yeah, that's fine. Yeah, so sorry, if you go to the top where it says autosave on the top left hand side of your screen, and then if you just go down that lane where it said slideshow, I can do it from my side. Just bear
Yeah,
with me.
because I can't see it on my screen.
Yeah.
'Cause it's not showing me what you said for whatever reason.
So whilst we wait, oh, it's working. Okay, I was going to ask you a few
My
questions.
apologies.
No problem.
Go ahead, Campbell. I'm sharing the screen for you, so you can
Okay.
presentation. So you go ahead. Thank you.
Okay, so as I was saying, of the 1.4 million units of blood that we donate to various parts of the NHS every year, 475 new donors are needed of all types every single day. And of that, roughly 250 new donors are needed just for people with sickle cell. So put that into perspective. I receive roughly 10 to 12 units of blood every 4 weeks, and it takes between 132 and 138 people a year to keep me alive, and I'm one person. So the need for more blood donors and better ethically matched blood is increasingly more important in the UK. There are roughly 18 to 19,000 people in the UK with sickle cell SS. 1 in 79 babies in the UK are born with sickle cell trait. Roughly 300 babies are born every single year with sickle cell, which is sickle cell SS, which is why it's also the largest genetically inherited illness in this country, and why better ethnically matched blood is important. So every time you receive blood, the blood you have has particular antibodies in it. The donor blood has particular antibodies, and it has to be an almost perfect match. It has to be a 99.9999999% perfect match. Otherwise, a person will have a reaction. And that reaction can range from anything from hives, which is just itching of the skin, to waking up in intensive care weeks later, which has happened to me. And every time you have blood, you have to make sure that match is perfect. And you've also heard us speak about the RO subtype and why that's important. Now, the RO subtype is on the plus blood groups, so A pos, O pos, B pos, and AB pos. 53% of the Black and brown community are of the RO subtype, but yet we make up less than 3% of the donor population in the UK. So you can see that there is a mismatch. We have the largest genetically inherited illness in the UK, but we make up one of the smallest donor groups. And because more and more people with sickle cell and thalassemia, which affect the same groups of people, and the largest two communities in the world are Africa and India, need blood more and more. The need for more people of Black and brown ethnicity to donate is increasingly important. Donating blood It's simple, quick, and painless. I posted a link in the chat and QR code that you can click on, or you can use your camera to find the link where you can register to become a donor. And it takes roughly 12 minutes to donate a unit of blood. And each unit of blood can save up to 3 adults or 6 children with each unit of blood. And the RO subtype is important for people with sickle cell because within the walls of the red cell of the RO subtype, there is an enzyme that means that when myself and others receive the blood is more beneficial, the blood is a better match, and it reduces the chance of me having a reaction, which is important. Because if you have too many reactions and you build up too much of the wrong type of antibody, unfortunately, you'll get to a stage where we cannot match your blood, even some of the rarest blood groups, and you can't have blood, and consequently, you will die. In the last year and a half, I personally know 4 people that have sadly passed away because they could no longer receive blood, because not enough of our own community donates blood. And I understand that there is misgivings, historical mistrust of the NHS, and the question is, what is the NHS doing with their blood? And it's simple. They give it to people like me and other sickle cell patients who would not be talking to you now if it wasn't for the amazing people that donate blood. If you did not donate blood, I would not be having this conversation, and I sadly would have died years ago. I've spent more of my life in hospital than I have out. I hold an unusual record of spending 2 years and 8 months, 2 years without ever leaving the building as an inpatient in hospital. And the only reason why I was able to leave the hospital, have the job, and have the life that I have now is because of blood donation. And at that time, I received roughly 3 to 5 units of blood every other day for over 2 years. Just think how much blood is needed daily just for people with sickle cell. Sickle cell is a debilitating illness. It's a life-changing, it's a life-taking illness. And most of you know that the main thing with sickle cell is pain. Sorry?
Sorry about that, Campbell. Please carry on.
Yeah, sorry. I have been in pain every second of every minute of every day of my life since I was 6 months old. I go to sleep in pain, I sleep in pain, and I wake up because of pain. And the only thing that has kept me here, kept me reasonably healthy, and allowed me to have a family is blood donation. Like I said, more and more people with sickle cell rely on blood. So, for example, if you're prone to strokes, where you tend to be prone to stroke as an infant between the ages of 2 and 16, and as a preventative cure for that, you're given blood, usually either as a transfusion, where blood is just given to you, or as an exchange, where we take off blood and you get blood at the same time, which is what I have, an automated exchange, where some of you may have seen a dialysis machine, and it's called a cell separator. It looks very similar to a dialysis machine, and it takes all day, but it uses a lot of blood, which is why we are asking for more and more people from our community to donate blood. Everyone, and I mean everyone, on this call knows someone with sickle cell, has met someone with sickle cell today, or has someone with sickle cell in their family. That's how common sickle cell is. And it kills a lot of people. And a lot of people die from sickle cell because of the cumulative effect of what sickle cell does to your body and not receiving the correct matched blood. At the beginning, it was mentioned that I sing in a choir called the B Positive Choir, which some of you may have heard of. The year I joined the choir and the year that we sang on Britain's Got Talent, got to the final, I went to 18 funerals in a single year. 2 years ago, I went to 9 funerals in a single year. Last year, I went to 8. 2 weeks before Christmas, a member of the choir sadly passed away from sickle cell. She had previously had strokes and was receiving blood, but it became harder and harder to match her blood because not enough of us donate blood. So why I'm here today is to explain that giving blood is quick, simple, and painless, but makes a massive difference. Like I said, if I were to give you a bottle of water and say to you, this bottle of water is a magical bottle of water, and it will keep replenishing itself consistently, and it costs you nothing, but you can save 3 adults, 3 members of your family with this bottle of water, and it costs you nothing. There isn't a single person on this call that wouldn't take that bottle of water. And it's the same with blood. Every time you donate blood, your body makes that blood back up roughly within about a week. And men can donate up to 4 times a year, women can donate up to 3 times a year. And the reason why that is because women have a naturally lower iron level than men, and women of color also have a naturally lower iron level. And we're trying to encourage the government to lower the level set by NICE, not by NHS blood and transplant, set by NICE, at what the iron level should be. And why it's important, why your iron levels are set, and why when you're asked, are you anemic and your iron levels are this, is because when every time you donate, if your iron levels are too low, you'll faint. And people say, no, I never faint. You do. You will faint every single time, and then we cannot use your blood. Why we also ask you to not do any exercise, make sure you've drank, make sure you've eaten, don't drink alcohol for at least 3 days. And when it comes to religious issues around donating blood, there is only one faith on earth that prohibits you from donating or receiving blood or any other organ, and that is Jehovah's Witnesses. Every other faith on earth doesn't have a problem. If you're Muslim, as long as you ask your imam and your imam's okay with it, and which all the imams I've ever spoken to don't have an issue. And I've done blood drives and spoken at mosques up and down the country. I've spoken at some of the biggest mosques in this country. So religion is not an issue. And if I'm being honest, as a community, we cannot keep using the excuse of we don't know what the NHS is doing with our blood, or I don't know what they'll do with our blood, or I do not like needles. If you have piercing or a tattoo, you can't tell me you're afraid of needles. And it does not hurt. If you stub your toe, that hurts way more than that tiny needle. I have sickle cell. Sitting talking to you now, I am in pain. I took 40 milligrams of morphine before this call, just so I can sit still long enough to speak to you. That's how important blood donation is. So we need more people from our community to step up and recognize the fact that they're helping people that look just like them. They're helping members of their family, their friends. And blood donation is important for childbirth, operations, cancer treatment, a host of other illnesses. If you call an ambulance and you need blood, there is blood in the back of an ambulance. There is O positive and O negative blood in the back of an ambulance. You turn up at A&E and you needed blood. The blood is there. And unlike the movies where you see people just roll up a sleeve, it's not like that. Your blood has to be a perfect match. In worst cases, you can kill someone. So we need more people to donate blood. Some of the rarest blood groups on earth are within the Black and brown community, which is why it's also important that we donate blood. Like I said, it takes 12 minutes. 12 minutes of your time. You took longer deciding what you're going to wear today than it takes to donate blood. You would spend longer in a coffee shop than it takes to donate blood. You have been listening to myself and the last speaker for longer than it takes to donate blood. So please consider donating blood. It's quick, simple, painless, and it keeps people like me alive. Thank you.
Thank you, Calvin. Again, your story is so compelling in terms of just your journey and how you're currently living your life, currently in pain, and the impact our donations are making in terms of lived experience. So thank you so much for your talk. You did bring me on the verge of tears, so thank you so much for just being so open and sharing your story.
You're welcome.
Thank you. So again, if you stay on the call, I'm sure people are going to have lots of questions for you at the end. Next, we have Dr. Khadija, who's a medical doctor with lived experience of sickle cell, and she's also has blood transfusions as well. So she's going to tell us a bit more about her experience and also just bringing her medical background into the session as well. So Khadija, I know you're here somewhere. If you can turn on your camera, and I'll turn off mine, and you can just begin to share your story. Thank you so much.
Good morning, everyone. My name is Khadija. I'm a sickle cell patient. Thank you, everyone, the presenter, Dr. Julie, Dr. Neka, Kelvin. So I'll be sharing my experience today. As a sickle cell patient, I've had to be transfused maybe more than a couple of times. And I remember the first time I was going to have a transfusion, it was many years ago. I was reluctant, really, really reluctant, because I felt like my body, my blood was going to be contaminated. I mean, with my illness, I shouldn't be doubting that, right? But looking back now, many years later, I always say a silent prayer for the doctors who treated me then. And of course, I've gone on to have a few more transfusions after that. Recently, I had the opportunity to visit a center, and I've seen other sickle cell patients who've needed to be transfused on a weekly basis, fortnightly, monthly. They need regular blood transfusions. And every day I learn a lot. I learn something new about my illness, even though I've lived with it for all my life. Following that, I visited another center, or transfusion center, and it was sad to see that I spent a couple of hours there and I didn't see anyone from our community who had come to donate blood. It was sad to see. And I tell my friends and my family, I tell them all the time, guys, please go and donate, help us, help people like me, we need you. And like Kelvin rightly said, our community, we have the thing in our blood that helps sickle cell patients like me and others, especially for the others who need blood on a regular basis. It's hard living with sickle cell, as Kelvin says, but we survive each day. We try our best. And thanks to the professionals who take care of us. So please, let's go there and donate blood. And like Dr. Neka said, from a religious perspective, make the intention, go out there, consider it an act of charity, and give blood. And just in case, I mean, you go and they say you're not eligible, of course, there's going to be a checklist and all the criteria thing. Don't feel bad. Spread the message. Tell your friends and family. There will be someone out there whose blood will match and who could be a regular donor. Thank you, everyone.
Thank you so much, Dr. Khadija, for joining us and sharing your story as well. Again, if you could please stay on the line, I'm sure there's going to be lots of questions at the end. And we have one more speaker before we do questions and answers. So next we have Dr. Lewis, who has a background as a GP. He also has lived experience of sickle cell, and he is a life coach. So he's going to share his story and journey with us. Thank you.
Hi everyone, good morning. My name is Dr. Lewis Thomas. So yes, I'm a ex-GP, recently having transitioned to become a life coach, and I have sickle cell hemoglobin C disease, which is slightly less severe. However, I've still been hospitalized multiple times, in my life, and I am very concerned about the possibility of ever needing a blood transfusion, as I've been fortunate enough not to need to have one yet. But I just wanted to say thank you for the other speakers sharing all of the information. Neka and Calvin, your experience is really moving. Thank you for sharing that, and Khadija. So I just want to be brief and just make one additional point, kind of about my lived experiences being a black male going into hospital in sickle cell crisis, in pain and needing morphine. And obviously being a doctor, being fully aware of the management of sickle cell and the protocols and what I need, and seeing how the sort of systemic racism can impact that. So the the thing I wanted to share is that this is obviously something that we experience as sickle cell patients that causes a lot of unnecessary pain and suffering when we are, trying to get treated fairly and management to relieve our pain. And systemic racism is something that is very difficult to do something about. However, the flip side of that is that with this issue of there being a lack of black blood donors and how important it is to actually have that blood available so that we're not getting adverse reactions and so that, people like Kelvin are able to actually just live and function. Um, it's it's really it's a really easy way of actually overcoming that problem of something that has been created by racism historically. And I think we just need to be aware of that need to, take action to help our own community and not let sort of historical myths and misconceptions contribute to furthering the suffering that is being caused by, people that are already dealing with a lot of pain and having to go into hospital and for me, I've I've not I hate going into hospital because of this issue. Like the pain is one thing, but it's having to explain myself and having to, having to be treated in such a way that makes you feel like you're not worthy of, being treated like a human being. Someone's in pain and you have something that can help and can relieve that pain. Why would you not just do that? So I think that was the main point that I wanted to share. And yeah, obviously, you can ask questions later on about my sort of transition from being a GP and sort of the issues that made me stop working as a doctor. But a lot of that was down to the way that sickle cell impacted my life. And now I just want to make sure that we are improving a life for people with sickle cell, and that if there is any situation in the future where I possibly need emergency surgery and would require a blood transfusion, or even just, a routine surgery that I would need blood in order to not have a sickle cell crisis. I just want to be, comfortable that there would be, blood available. So that's just my sort of experience and some of the ideas that I've had that run through my mind as someone living with sickle cell and may potentially need a transfusion. So thank you for listening.
Thank you, Dr. Lewis, for joining us. So now I'm just going to go through some of the questions that we've had during the session. So if Dr. Khadija, Dr. Nika could join us, turning on cameras, and also Calvin as well, for any questions that may come through that you might be able to answer. So I think one of the first questions that I can see in the main chat actually is how can people find out if they're a carrier of the sickle cell gene, or yeah, their carrier, and also if they can find out their blood group and where they can find this information out. So I'll just open up to you, and I can also give my take as well.
Okay, so if you were born before 1982, everybody in the country has a Hill prick test if you're in the affected donor groups. So once you're a baby at 3 months old, the doctor will give you a Hill prick test to see if you're a carrier of sickle cell trait or thalassemia trait. Your blood type, you can request it from your GP, and it's free. More importantly, same as your genotype testing, which we encourage everyone to do. To go to your GP if you do not know your genotype and request a genotype test. Now, some GPs, unfortunately, will try to charge you, but it is actually unlawful. And it's a free test because it is a mandatory thing under the government program they brought in years ago, that everyone in the affected group has a right to have a genotype testing. And it's a blood test they take, send it away, a couple weeks later, you find out your genotype.
Yes, I agree with that. One of the things I had to check myself on recently myself is that sometimes I think one person did come to me a few years ago and asking for this test, and it wasn't a request I ever heard of before. So I automatically said, "Oh, I don't think we're able to test that one for that." I had to find out more information, and I realized, yes, we can test for it. But then also I had to check myself because I thought if a Caucasian person came up and asked, "Oh yeah, I wanted to find out if I'm a carrier of cystic fibrosis gene,"
Yeah.
automatically I'll be like, yes, I can refer you. But this is not a test that I thought of, so and it's not really taught about in terms of medical training. So I really had to just assess my own biases in terms of that. So yes, if they do push back and say no, we don't do this, then as Calvin said, you are entitled to it. So please do let them know that you know your rights as well. And again, because even with the test, yes, we are tested if you're born in the UK, but for those people who are immigrants, they may not have had that test before.
Yeah.
So this is a very valid question. And we do know that all women, we do get tested for these if you're a carrier when you're pregnant. And it's only if you're a carrier, then they will test your partner as well. But if you're not pregnant, you just want to find out for future reasons, you can also ask your GP. So I think Dr. Neefman's going to come in.
So when you go for blood donation, you get your results of your blood test, your subtypes, they give you more details as well.
Fantastic. And I think the next question that I have is it safe to give blood if I have an underlying condition like anemia or high blood pressure?
Once you go to
Yeah.
sorry. No, feel free.
Right. So I'll talk about high blood pressure, which I thought of because I'm a doctor. I have high blood pressure. I'm on medication for blood pressure. That thought came to me. So when I was filling the form, they said, do you have blood pressure? What medications are you on? And I wrote, and I still donated. The other one was your iron level, which they will check on that day. If it's not okay, they will ask you probably come back. So you, if you don't have enough, it won't be taken.
Thank you. Yeah, that's perfect. Next question I have is, will giving blood will weaken my immune system or affect my energy levels?
Not necessarily. So when you donate blood, different blood components can't regenerate itself at different times. It's not all at the same time. And what we say to you is, once you've donated blood, to not do any exercise that day. So if you're someone that used to go to the gym, jogging or running cycle, we ask you not to do an exercise, strength exercise before and after you donated, and to drink plenty of water. Some people may feel slightly tired and fatigued, but which should be okay by the next day. But it doesn't affect you other than that.
Also, as a lived experience, after my blood donation, I didn't feel anything different. I was fine. They'll ask you to sit down, give you snacks, give you a drink, just observe you for a few minutes, and that's it.
Thank you. Oh, I've actually seen someone's just raised their hand. So I'll just quickly go to Basola, sorry. If you unmute yourself and we can ask you a question. Or can I do that? Yeah.
Can you hear me now?
I can hear you. Thank you.
Okay, perfect. Thank you. It's Bisola. So it's more of an observation than a question, really. And I'm listening today, and I'm going to be changing my practice, that's for sure, going forward with this knowledge. In terms of the information and me being in the right places, it's quite surprising that we don't have blood types as a standard information on people's notes. Because if you're going to do a drive for, if God forbid something happens that is national, we put everything in place to ensure that everybody knows via different forms and I'm not expecting anyone in here to potentially, if there's anyone in here that can inform on policy or strategy, that surely this should be fundamental, not because solely for this, there are other conditions, of course, and it will make sense to me listening in that it ought to be wherever the information is gathered, so be it blood donation or be it because you're pregnant, because your partner's tested, whatever, that information should be on your record so that people can be contacted via a mass communication of some sort to increase blood donation. Yeah, I'm just surprised that that is not the case. I had a friend, unfortunately, that passed away through sickle cell. So it's challenging watching from the outside in as well, supporting people that have that ongoing. But unfortunately, the awareness is still not enough and around us. And even though you might be aware, I'm not sure that we necessarily are being proactive. And the way Calvin is explained today, I didn't get a chance to listen to everybody else. Should be a drive to definitely start to donate. But it's just, I'm just sitting here thinking, what more can be done? Because you go into hospital and God forbid you need an operation, you assume there's going to be blood ready for you to use, and somebody must have donated that blood in order for it to be useful to you. And therefore, I'm just sort of expressing my thought process, if you like, just to say, obviously we need to do more and do more for the right reason to support people that really truly need it, such as those that unfortunately carry this disease. Thank you.
Yeah, thank you for your point. Is there anything anyone else wanted to add to that?
Yeah, if I understand you, the first part you made about the blood donation and if someone was sick. So when you donate blood, you can't choose who you donate that blood goes to. If you're donating a specific organ, so if you're doing a liver transplant and you have a specific donor match and the husband and wife can donate that way, that's different. But for blood, you can't choose who to donate blood to. We have a system in this country where we're not paid to donate blood, and the blood can go to anyone. The only difference is if you're an RO subtype, your blood is always going to go to someone with sickle cell in this country. That's the one area where you know where your blood is going. But other than that, you have no choice or say in where your blood is donated, because that opens up a whole can of worms that we don't know about.
Thank you. And I have another question from the chat. Person asks, how can I encourage more people in my family or church to become donors?
So from what you've learned today is the way of starting. And if you go to the NHS blood donation website, there are many YouTube videos you can just send to them, send to your group chats, people's lived experiences, how easy it is to donate. So that's one way of starting. Even if you don't want to talk too much, just send messages and let that do the job.
Can I also mention the fact that if you're part of a large church group, community group, business, and particularly if you have a large black and brown workforce or community, you can actually write to NHS Blood and Transplant and request us to come and do something called a Watch Your Blood Type or a general recruit. So if you have a large community church group, and as long as the numbers are sufficient, we can come there and I can do a talk like we did similar today, and we can register people, book you an appointment, and sign you up to donate and book you an appointment. If you're a first-time donor, you have to donate at one of the main donor centers. But once you've donated once, you can donate anywhere you want. Where you live, where you work, and you continue to donate for the rest of your life. The cut-off point used to be 65, but now the law has changed. That once you've donated once before your 60th birthday, you can donate forever as long as you're fit and healthy. So that's one way I would actually say to lots of people, if you're part of a large community group, if you email somebody at NHS Blood and Transplant and say, we have, say, more than 50 people or 100 people within our church group, we would like you to come and do a general recruit, which is just registering people and booking appointments, or a Watch Your Blood Type, where it's a single fingerprint test, which takes a couple of minutes. And for a thank you for registering and agreeing to becoming a donor, we tell you what your blood type is. Because surprisingly, most people have no idea what their blood type is. So those are the two ways I would suggest doing that. And if you can't donate, encourage people. If every person that couldn't donate could encourage one person, it wouldn't take very long to have a donor center filled with people that could donate.
Thank you so much, Calvin. I think the next question I can see is are there any similarities of animal bloods to human bloods if we have a shortage, and would it be possible to outsource into closely related species?
No. Simple answer. Sorry.
Not at the moment.
Okay, thank you. And then, does blood transfusion have implications for weight loss?
For weight loss, you say? Not as far as I'm aware. I don't know if the doctors know anything that I don't, but as far as I'm aware, giving blood
I
doesn't
would
have
say
any.
it does. It doesn't, because your blood is what is needed to move nutrients and oxygen around the body. Weight mainly in the fat cells and muscles and bones, so not likely that much, because and your blood comes back within 3 months, regenerates.
And then the next question I can see is, if we're taking multivitamins, can we donate blood? Also, I was once told I cannot donate blood due to being overweight, over 80 kilograms. Is there a weight threshold for blood donations?
Yes, there is. So when you donate blood, once you fill in the form, you're asked a series of questions, and you get to see a nurse who will then ask you about your weight, and various medical conditions, and what medication you're on. Depending on what medication you're on, they will say to you, you can donate or you can't donate. So, for example, diabetes is prevalent within our community. If you take insulin, you can't donate blood. If you take metformin or diet control, you can donate blood. The reason is because insulin is a living organism which can be passed on through your blood. If you're taking iron tablets permanently, you can't donate blood. And the weight is, if you're under 7 stone, and I'm from the top of my head the top weight, but there is a weight limit, a lower and upper limit for donating blood, and that's a similar reason to your iron levels and whether or not you're fake. Those are the safety cards, which are set by NICE, not by NSFPC.
Thank you. And we have a question in the main chat from Ada, who's asked, can a menopausal woman donate blood?
Yes.
Yes.
It depends on what
As long
medication
as
you're
your iron is fine, you can donate blood up to the age of 65.
No, beyond that, actually, there's no age limit now.
Okay,
Sure.
no, all right.
And anyone that has a driving license, you have to opt out, so you automatically become a organ donor as well, which you have to opt out of.
Thank you. And I think that's answered Joy's question about whether or not there's an age limit on giving blood. I think I've come to the end of all of my questions. If anyone has any questions, just pop it in the chat or raise your hand. If not, I'll hand over to Sam. I think we've done all the questions. So thank you so much for taking the time, to all of our speakers for joining us today. It's not easy to go out Saturday morning, but this is such an important topic, and I've even learned so much myself from just hearing all of your stories, which I will take into my practice. And I hope that our listeners will also maybe have a change of practice, or maybe encourage 1 or 2 people at least to go out and give blood as well. All right. Thank you so much. I'll hand you to Sam now.
Thank you all.
Hello, everyone. Thank you very much, Dr. Neka. Thank you very much, Dr. Julie, Calvin, Dr. Lewis, and Dr. Khadija. A very, very inspirational session. And as I was saying earlier on in the morning, I think it's time I, I go donate some blood to help our community out, because, we desperately need it. And I'm looking forward to finding out what blood type I am, actually, because I didn't know that that's something I could ask my GP. And well, now I can go forward and, be a bit more confident and ask them to provide me that information. So when I do go to give blood, I'm a bit more reassured that my blood is being used. Luckily, I am not a carrier, so hopefully I'll be able to go through the process. Thank you very much, everyone, for listening and taking part in the chat and LinkedIn, YouTube, Facebook, sending your questions. We greatly do appreciate this. Hopefully that you can use this session to go to educate your community members, your network, your friends, your family, And yes, let's please, as the talk has been today about giving blood, let's please all go donate some blood because our community really needs that RO blood type. I'm just going to quickly go through these slides very quickly, just telling you about things that are going on within Khan and within the community, and feel free to ask us questions or contact the contact information that's on the slide for more information. And I'll be quick so that we can enjoy the rest of our Saturday. Next week, we'll be having another health hour session. The topic is going to be released soon, so look out for that information on our socials. And it's going to be at the same time, same place, with more information provided by Black healthcare professionals next week, Saturday. We recently went to the Parliament on the 14th of May, talking to those in the Parliament about the importance of fibroids and reproductive equity. And we are currently doing a call to action for anyone that's had an experience with fibroids and wants to speak up, so that we can put together some information how we can help change policy that's going on in the UK, because this is a very important topic to our community. We know that over 80 to 90% of Black women will develop fibroids at some point in their life, which is it's quite shocking to hear, to be honest. But there's not much being done in terms of healthcare, in terms of policy, in terms of research, and we want to change this. So please feel free to take part in this call to action, scan this QR code, and also please take part and share this information with your friends and family who may have fibroids. Thank you.
Sorry, Sam, we didn't see the slides. If you could just share that.
So deep apologies. Let me just share that. Sorry. Can you see my screen now? Yeah, you should be able to see my screen. Apologies, everyone. Sorry. So yes, this is the fibroids QR code. Please scan this and take part in the call to action. So Windrush is coming around the corner. On the 21st of March, we'll be at Alexandra Park celebrating Windrush. It's going to be a great year. The last few ones have been fantastic. The weather's been great. We've had people come out. We've had family members come. We've had community members come in there in the large numbers to come and celebrate Windrush. This year, we'll be focusing on routes to routes across the Caribbean to Greater Manchester. So you're going to be expecting performances on stage. You're going to be expecting we might even have a comedian this year. We never know, but we're going to be expecting lots of fun things going on. There's going to be a full day at the park. There's going to be a football tournament. There's something for everyone. So if you're in the northwest of England, please feel free to come down to Windrush to celebrate Windrush Day with us at Alexandra Park on the 21st of June. It's free entry. And also, if you have a store business that you want to promote something that you think is quite important that the community should know about, we have store opportunities available. Please scan this QR code and get in contact with us to book a store. There's going to be hundreds, hopefully thousands of people there. So this is a great opportunity to expand your network and get involved in something that you may not be able to get those community members doing the usual methods, but talking to them in person, you'd be able to speak to them, sell your products, tell them about the opportunities that you have around you, and it'll be great to see lots of stalls there being interacted with the community members that have come to celebrate Windrush Day with us at Alexandra Park. We also have a Windrush celebration happening on the same day in Tower Hamlets. So if you're a Tower Hamlets resident and you're listening to this, or you know anyone that lives in Tower Hamlets or in that general area, please invite them to come down to 160 Whitechapel Road, London, E1 1BJ, for a celebration of Windrush, and also with a twist of health and wellness. So there's going to be entertainment that's going to be there, cultural showcase. There's going to be food available for the attendees, free health checks, something for everyone. As I said, it's a family fun day. So please come down and celebrate Windrush Day with us at Tower Hamlets if you're based in that region. Just get to the next slide. Yes, the Black Healthcare Awards is coming up on the 12th of July in London. This is a celebration. If you're into the healthcare space, this is your opportunity to get some tickets or get a table and come celebrate those within the healthcare. We know that the Black healthcare workers are the backbone of the NHS. That's something that's been well known since the Windrush time, tying into what I was saying earlier on. So please get your tickets, come celebrate with our patrons, come celebrate with the judges, come celebrate with the people that were nominated for these awards. This year we've had over 300 nominations, and it's quite fantastic that people in the community have been sharing the achievements of their colleagues, their friends, their family, and want them to be celebrated. So please purchase your tickets, come down and celebrate with us. Last year we had over 500 people at this event. I'm sure this year we're going to have just as many or probably even more. So this is an event that you don't want to miss out. And feel free to scan this QR code and look out through our socials for the links to purchase your ticket or purchase your table. And I want to say a big thank you to all of you for tuning in today. It's been a nice full day of learning about blood donation. As I said earlier on, I am definitely looking forward to donating blood and learning about my blood type subgroup. And hopefully you can use this information to share with your network and your families to help improve blood donation outcomes for our community. Thank you very much, doctors. And thank you very much for lived experience individuals that we've had today. And thank you very much for listening.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.